28, where Jesus is saying, "Come to me, all who are weary and heavy laden, and I'll give you rest." So church will be a place of solace, a place of encouragement, a place where all people will feel accepted, and people that also be willing to walk with those people, so that when they come to church, if they need medical attention, if they need a psychiatrist, there will be a source of reference apart from praying for them and encouraging them and giving them hope. You also need to give a direction and encouragement for people to seek medical attention. And as we were saying, it's a disorder, something but gone out of order but can become back to order. And we believe that as a church, this should be a healing community, a place where people will encounter the presence of God, but also a place where people will be accepted and people will be adequately advised what they need to do. So I think the issue of integration comes in very handy to be able to integrate the scientific and the spiritual, because the Bible says God gave gifts. Some were given to be teachers, some were given to be pastors, some even administrators. That's a gift. So if all those gifts are able to work together in church, I think we can have a very dynamic community and can be a source of healing to our community.
So when I talk about integration, what we are talking about is integrating the teachings of the Bible with the mental health science. Purely, if it's not in the Bible, it is not part of the integration from where I come from.
Thank you.
It is the teaching of what we teach.
Thank you.
Yes.
Thank you, Dr. Mumbe. Thank you, Dr. Mumbe. And I'm turning this way because I want to pick questions from the audience.
Good afternoon, everyone.
Thank you.
My name is Sharon Adhiambo. My question goes to Dr. Mumbo. My question is, how does stress lead to mental health, and how do we control it?
Stress begins, stress is caused by many things. Like now, if you hear gunshots, we'll get stressed, unless you're a KDF soldier who can tell the difference about what's happening. We have things we call stressors, and therefore we know we have all sorts of stresses. But then what the stress does, not only does stress result in a psychological, meaning the mind, the thinking response, but it also results in what we call a physiological or the body response. So for example, as Dr. Paris there had said, you may have your heart beating fast. Why is it beating fast? The body has released, for example, one of the chemicals it will release is norepinephrine or cortisol. We have, or what we call adrenaline. You know, local man will talk about adrenaline and many others. So it is like your body is running a 42-kilometer marathon at the speed of a sprint. You know, even those long-distance runners, they don't run the marathon. If you watch them, ni kama anacheza tu kwa barabara. But he will run for 2 hours. But if he tries to exert himself like Omanyala running the sprint, he won't get very far. So even stress just affects us. So the body is just running, but running quickly. So what it does, it breaks the body. You get to a stage we call exhaustion.
Thank you.
Or general adaptation syndrome. Then you start to manifest conditions, headache, constant. So you're going to Dr. Joy, I have headache. Unajua kuna hapa na hapa, oh my back, oh my knees. And when everyone tests, there is nothing wrong with the physical body. Then we say it is stress. But I won't go into the treatment, but let's talk about prevention very quickly, because I think it will be useless to tell you what it does and not help you figure out what to do. Number one, we have three things only. Number one, if you can predict your stress. For example, if you could have predicted it would rain and you went to the hair salon yesterday, so ungebeba mavuli. ama ungesema ukae nyumbani. But if you didn't predict, my sisters will have a problem leaving church. The ability to predict your stressors is very important. Now Christians will say, we are calling those bad things and then they will become. No. Where there is no vision, people perish. Just predict, it is okay. The things that will bring you down. But then thereafter, predicting is useless unless you can come up with a plan. Plan ahead. It wasn't raining when Noah built the ark. Once you plan ahead, the plan is useless if you don't put it into effect. And then get social support. That is why we have support groups. If it's widows, we put them together. If it's the teens, we put them together. You don't want to put teens and mothers. The issues of mothers and teens are like, I don't know, east and west. But we are saying your ability to predict, your ability to come up with a plan, your ability to implement it and get social support will actually help you overcome stress. It doesn't matter what it is, you will manage.
Plan ahead and act on it. I think we will be taking 2 questions. We combine them so that for the interest of time.
My question is, Bishop has helped us to know how the church should deal with mental health wellness, but also wanted to find out earlier, Dr. Mumbi, when she was speaking, she told us practical, simple things that help us know that this is a mental health issue. Like somebody can sweep and then they refuse to sweep for the neighbor. Somebody can refuse to remove the neighbor's clothes and the rain hits them. How can also a community, how can a community also come up with measures of helping such people, because we live with them, and at times we may not know that this is a mental health issue. So we stigmatize and do some other sort of things. So I wanted to see how to know how the community can also help to deal with that issues when they arise around our area of residence. God bless you.
Community participation, right? Let's pick another question.
I'm just going direct to my question. The first question is how to know your child or adolescent may be struggling with mental illness. That is one. And then I have something from a friend. She's called Mwende and she's saying in Kiswahili, mamangu akona mental illness. Akiwa ametulia, kuna time anaweza anza kusema mambo alifanyiwa mabaya na ilipita, na kuna wakati akikasirika hutaki kuongea na mtu, anaendanga kulala. Naweza saidika aje niweze kumsaidia? My mother lived a very normal life until she was pregnant of me, and after she delivered me, she was diagnosed with a mental illness. I was taken from the hospital. She was hospitalized. Help me understand how can I offer help to my ailing mother in a healthy way. I'm now a grown-up with a family, but can't cope well in fear of something may happen to my mom. Thank you.
How can the community support? Number one, we just say be there. Even when you don't understand, just be there. What we called the ministry of presence. Support. If the person has no knowledge about where to go, like the last question, mama yangu anaweza saidika aje, or how can they access help? You point them in a direction where they can get help. The real thing is to meet the immediate need. Everyone will have a different need, but meet that immediate need.
Thank you. Dr. Joy, tutajuaje mtoto, how do you know that your child akona mental disorder? That question came from that corner.
So for children and adolescents, it is important to note that even children experience mental health issues, and there are a variety of mental health issues that affect children. Some of the ways you can be able to get an idea if your child may be struggling with a mental illness is maybe your child starts withdrawing, they have persistent sadness, they have trouble at school, they have trouble with concentration. Maybe your child has been performing well and all of a sudden they start performing poorly. Your child may also become very irritable. Children, for example, children who are depressed, they may not necessarily show a very sad mood. They may be very irritable, or they overreact to things. Maybe a minor thing and they overreact, they really overreact. You may ask yourself some questions. Also, if they are self-harming or talking about self-harming, if they're talking about committing suicide or talking about death. Also,
Thank you.
yeah, I think those are the ones I can think of. Also, they can present with physical symptoms. Your child may be complaining of constant headaches or constant stomach aches with no organic cause. You know, that may help you to know if maybe they could be struggling with a mental health
So
issue.
there are those children perhaps who can also just pretend that they are ill and they are not ill, and that
Yeah.
could be still a mental issue.
Yeah, or they faint at school or stuff like that. They are actually having some issues going on.
I think, let me just
Yeah,
add.
thank you.
I think it is not necessarily pretense. It is not necessarily pretend that they are feeling something. They actually present with physical manifestations. They will have, say it's a pain, abdominal pain that she has mentioned. They will actually keep having that pain. They will actually have the headache. It's there, they can feel it. But as much as we investigate and we do all sorts of tests, there is no physical, nothing physical being seen in any of the tests. So the other thing also is, if your child presents with any of these complaints, do not, don't push them down. You know, don't behave as if they are pretending. Let's actually let them see that they are, whatever it is that they are complaining about, or whatever they're manifesting with, let them see that you're listening. Let them see you're hearing. Let them see you're in their court. Because if they feel like you're not understanding, many of these are the ones coming to us with either hysteria. There are very many we manage in the emergency room with self-harm, what we call parasuicide or suicide. Those are the ones who present to us, because that is a cry for help. You find someone has taken 100 paracetamols because they can easily buy the Panadols. But what are they doing? They're trying to cry out. Why? Because when we said, I have this headache or I have this stomach ache, they don't feel like any of us listen.
And I think it is a very important point to note as parents that we have to be keen on picking the signs. Thank you so much. Bishop Muko, there is a question that came of a lady whose mother is coming back home, and probably now she is going to start becoming a caregiver. Maybe what you do is share your experience when you first knew that you have a patient in the house who is actually coming home with these conditions.
Thank you. To me, it has been a long journey because basically, even before you got married, she was hospitalized. So, it's like you are in school, you are learning bit by bit. But the most important thing is to embrace them and to be there for them and to give them support. Because they will try to explain something, but unless you experience it, it's very hard for you to understand. Once you realize it's a condition and they need help, and they need your support. Without necessarily, might not be able to understand all those, but you realize there are people that you need to empathize with, to work together with. And I like the way the word caregiver, you are there to take care, to know that you are just there for them. So it's a journey that I don't know how long it will take, but as you walk, you get to know much, I started getting interested to know about depression, the causes. When she's going for a clinic, we are there together with my children. When she's taking medication, we are the one basically who are giving those medication to her. It's like you become a part of her life, and you walk together with them. So it's not something that you just do and move away, but it's like you're working together.
Okay, Dr. Mumbi, you want?
I had a question about that lady having postpartum depression and the daughter wondering what I can do. What Bishop has said is very important. But really, as a daughter, sometimes it becomes very difficult to attend to your mother. Now, we thank God that healthcare in Kenya is not where it was when some of us started working. If you walk to any government institution, Mbagathi, Lucy Kibaki over here, go to Madari, go to Kenyatta, you can access help at an affordable price. And that help, people used to say, you go to hospital, you get dawa. That's now not the protocol. Actually, now the current protocol, you actually are sent to either a counselor, a counseling psychologist, and the government has employed them. So do not shy away. Some of us look and think it's expensive. Do not shy away. If you have the ability to pay health insurance for your parent, I encourage you to pay the 500 NHIF. Hata kama atapata dawa Madari, they won't send her away without medication. There is intervention available. So do not stay with your problem at home. There is free help. There is help that is paid. You could go to Equity Afya. I see they're out there. If you find no one else, you'll find Farida because she's from there, and you will access help. So it's just important to know where to go.
Thank you, Dr. Mumbi. And,
I think I want to say to add something on that.
Okay.
And I will come at the front.
Yeah.
Because of the person who asked about, it's like the mother got depression after giving birth. That's what we call postpartum depression. And there is a possibility of that person also getting into depression because they are feeling like they caused their mother the problem. So even as they take care of the mother, they also need to be taken care of. They either go for counseling because they will start feeling guilty, they will start hating themselves, they will start feeling like mimi ndio nililetea mama yangu all these problems. So I would encourage Pastor Grace, whoever that is, encourage them also to seek help from a counselor so that they are able to separate themselves from what their mother is going through so that they are able to offer better help to the mother without now becoming a part of the problem. I think that is very key, isn't it? Yeah, thank you.
Thank you so much. Let's give her a clap. And
Thank you. I've got two questions. One,
say your name.
I'm Bain. Someone with severe depression. That person is drug resistant. You recommend a procedure called ECT, electroconvulsive therapy. Other people call it electric treatment. I wanted to understand how effective it is, and number two, does it have a side effects? Number two question is, I'm thinking on the role of the caregivers. They are very important, and in the long run, other people don't know what to do. in that situation, they listen up. Kijana yenu ni mwendo wazimu, you know, a lot of things. In the long run, they will also fall ill. Apart from the awareness, do you have the manual, or how prepared are we to push them so that in the long run, they will not fall ill? Thank you.
I have two questions. My name is Ruth Njuguna. A child diagnosed with ADHD, how long does the child take medication? And if the child stops medication, what are the consequences? I have another question. How do you deal with a adolescent child with self-esteem?
My name is Lucy, and I have two questions. The first question is, how do you help a friend or a colleague or a family member who is in denial about their mental health? The second question is, how do you handle childhood trauma that happens to kids and may cause mental illness later in their life? This could include rape issues, family divorce that will affect this child at their early childhood, but is a major cause of later life mental health issues. Thank you.
Okay, my question has partly been asked by Lucy. I wanted to find out, how do you deal with someone who is showing the signs of mental disorder, but would not agree to counseling or even going to hospital, but is also exhibiting signs of aggressiveness? What advice would you give to a caretaker?
Okay, I don't know whether I understand right that most suicide cases are as a result of a mental illness. Are there suicide cases that could come without a mental illness? And how come that, is it possible for a person to reach to suicide? How possible it is without anyone ever noticing or coming to their help? Then the next question is there something like personality disorder? And is it a mental illness or it's just a personality disorder?